Now listen, we don't want to throw guilt at women, but one of the reasons this has never changed foundationally in women is because they're told that it's not their fault and they were just the unlucky ones to get endometriosis. But it's totally not their fault. But I have to tell you, I have to be frank with you women out there, the forbidden information is that this can be changed and you women are indeed in control of this.
Good. Hey, everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 145, Hysterectomy. Should I? What if I did?
And today we're going to talk about some forbidden stuff that's been hidden from you for way too many decades.
And we want you to know that this podcast is the result of a request from a VIP listener in Maine who requested this subject.
Yeah.
So if you have a request for something we have not discussed, send an email to info@forbiddendoctor.com and tell us what you'd like to hear.
Yeah, we want to give a shout out to her. We're really thrilled that she had some friends that had some questions about this and excited. Anytime you want to do that, just send us an email and we'll try to do a podcast on it. So what we're going to talk about today is the overuse of surgery in one of the most common of areas, a woman's body. It's the second most common surgery on a woman. Did you know that? Yeah. A hysterectomy. It's second only to C-sections.
Also done on a woman.
Yes.
We have podcasts on the thousands of unnecessary mastectomies and other mutilations of the female breast that occur yearly.
Yeah. So in that vein, we want to discuss this often needless surgery. And it's reported as needless in peer-reviewed medical journals, the removal of the uterus.
Yeah, and in the sense of possible alternative approaches, as well, what to do to help mitigate the often suffered side effects if you've already had a hysterectomy.
Yeah.
Especially a complete hysterectomy that removes the ovaries as well.
Yeah, brutal.
So the 3 points that we want to cover are why do doctors recommend this, even though their own peer-reviewed journals say it's way overdone? What are the underlying causes or presenting symptoms? And what are better solutions to try before resorting to surgery? Mm-hmm. And so that, and we're going to, refer to some studies here that show that a hysterectomy, which is the surgical removal of the woman's uterus, increases the risk of congestive heart failure by 4 times.
Whoa. And
doubles the likelihood of coronary heart disease.
Wow.
And we would direct you to 2 of our podcasts on what does cause heart attacks and what does not cause heart attacks, which were number 127 and 128.
Yeah. This procedure, in my opinion, this barbaric procedure to excise or take out the uterus is now considered just a standard procedure for treating certain conditions like fibroids and endometriosis.
And by the way, African American women are at 3 to 5 times greater risk than white women for the fibroids you just mentioned.
Wow. So, but there's little research available that looks at the long-term risks of this procedure to a woman's health.
Oh, yeah. It's always been assumed that once you take it out, the problem's over. Now, the findings of the cohort study by the Mayo Clinic indicated that hysterectomy operations for conditions before menopause may have severe postmenopausal health risks later in life.
Severe?
Yeah, and so these researchers at the Mayo Clinic were showing that hysterectomy with ovarian conservation, which means to leave the ovaries behind, don't take them, is associated with a significantly increased risk of several heart problems, several cardiovascular diseases, and metabolic conditions as well. And we will get into that because these findings are published in Menopause, a peer-reviewed journal.
Yeah, well, I've had 6 C-sections, but I do believe truly that the C-section saved my life with my first baby because I was in labor for 18 hours and she was just going into convulsions. She wasn't dropping into the birth canal at all. And in fact, when I did have the C-section, her head was perfectly round, so she had not entered the birth canal at all. So I think it was really important that And I think it saved her life and my life that
Yes.
we were able to have
No
a C-section. Yeah, I think they are medically necessary, and it's wonderful that we have that crisis care, but they're way overdone. And also, too, when you do have a C-section, it takes out that, or excuse me, when you do have a hysterectomy, they take out the uterus. And what happened with me, was that I had so many C-sections that my muscles had split completely to the left and the right.
Abdominal wall.
There was no muscle strength there at all. So you, for Christmas one year, gave me a abdominoplasty.
Yeah, I did it right down there in the living room.
What?
No, well, you said I gave it to you.
You didn't know the talents Jack has. It was a present.
10 snips and some.
Well, it's
some leather
because,
punch.
I was always so self-conscious, but you said you didn't bother you, but it did me where, my skin was hanging over the C-section scar.
Yeah.
And so you gave that to me for Christmas and had another doctor perform it. He was really, really good. But anyway, he said I could have never exercised those muscles back. So he went in and tied those muscles up together, cut off excess fat and stretch marks, which was wonderful. And the wonderful thing is that after the surgery, it held my uterus in and my bladder in. And I commented to this doctor over and over. I was like, I can pee so much better now. And he seemed shocked and incredulous. Like nobody else has told him this, that the uterus. Well, he didn't think it through, maybe, that the uterus and these muscles, of course, hold my bladder.
Yes,
in.
yeah.
So it was a wonderful side effect for that.
So when you take the uterus out,
yes, you don't.
There is a gaping hole in there.
Yeah, and so your bladder falls forward even more.
Yeah, the ovaries fall down.
Yeah, so I was super thrilled that helped that so much. So I just wanted to give that little story so you can understand when you take this uterus out, you have less to hold the bladder.
Yeah, the body
and the ovaries.
You don't have a lot of extra open space inside of you. Like you open up the door of a grandfather clock and there's these big chains and counterweights in there that you can wind the clock with all this empty space. There's no empty space inside your lung cavity, your abdominal cavity, your pelvic cavity. Everything's crammed together. And if something comes out, things get misplaced.
Yeah.
Not misplaced, but their position changes.
Yeah.
So I want to quote here from Shannon Laughlin Tomaso, MD, who was the author of this study at the Mayo Clinic. She's also an OBGYN at the clinic. And she said this: "This is the best data to date that shows women undergoing hysterectomy have a risk of long-term disease, even when both ovaries are conserved."
Oh, I would say even more so.
While women are...
Oh, no, excuse me. You're saying even when they keep their ovaries.
Yes, they still have the risk of long-term disease. While women are increasingly aware that removing their ovaries poses health risks, this study suggests hysterectomy alone has risks, especially for women who undergo hysterectomy prior to age 35.
Yeah.
So, Mary, go ahead and read directly from the study.
The study shows that women who have had a hysterectomy without any ovary removal had a 14% increased risk in lipid abnormalities.
Yeah, that's just fat metabolism, the ability to process fat. So they kind of end up getting fatter.
A 13% increased risk of high blood pressure, an 18% increased risk of obesity, and a 33% increased risk of coronary artery disease. Furthermore, women under the age of 35 had a 4.6-fold increased risk. That's 460% increased risk of congestive heart failure and a 2.5-fold increased risk of coronary artery disease.
Yeah.
So 250% and 460% increase heart problems.
Yeah, Dr. Tomaso says this. She says, hysterectomy is the second most common gynecological surgery, and most are done for benign reasons, because most physicians believe that this surgery has minimal long-term risks. The quote continues.
Yeah.
With the results of this study, we encourage people to consider non-surgical alternative therapies for fibroids, endometriosis, and prolapse, which are the leading causes of hysterectomy.
And what are those alternative therapies?
Yeah.
And they go on to say of the approximately 750,000, okay, let's repeat that, 750,000 hysterectomies performed each year, gasp, 90% are unnecessary, writes Goldberg in Alternative Medicine, making the removal of a woman's uterus one of the most commonly performed unnecessary surgeries. Brutal, I say again.
Well, with these 750,000, this is Dr. Herbert Goldfarb, a gynecologist and assistant clinical professor at New York University School of Medicine. He said this: each year, 750,000 hysterectomies are performed, and 2,500 women die during the operation.
Wow.
These are not sick women, but healthy women who go into the hospital and do not come out, end quote.
Wow. 2,500 women died during the operation.
Yes, a year.
Wow. And then they face heart disease
of which they say
obesity.
90, yes, of which they say 90% are unnecessary.
Wow. So women are also frequently subjected to cesarean sections they don't really need. Now, I needed mine, but
and I agree with that because you have a small pelvic cavity.
Yeah, I don't know why
that's
that.
okay for me to say that.
Yeah, that's fine. And, I don't know why. My mother had 11 children just fine, but I suspect it's that candy store I worked at when I was going through puberty. I mean, I think I
wouldn't be surprised.
I just did not develop. I mean, my lunch every day was, pop and a Carmelo bar, and Doritos. It was just horrible. But I came back. But still, this is important. So with 920,000 C-section births performed each year,
which is just short of 1 million.
Yeah, the C-section has become the most common major surgery in America, and it's 4 times more likely a woman will give birth with a C-section today than it was in 1970. And that's according to The Medical Racket. It's a book by Martin L. Gross.
Yeah, and women are also at very special risk. We shouldn't say special, but for receiving all these unwarranted surgeries because of the results of a mammogram. And we've talked about this.
Yeah.
Because the high rates of false positives in mammography often lead to invasive procedures. And women who do not even have cancer to begin with end up being treated for breast cancer. So these women's bodies are carved up and altered, and they aren't even sick. So the question is, why does this happen?
Well, I'll quote Earl Mindell at Virginia Hopkins in Prescription Alternatives. He says, American physicians are generally way too eager to use the surgeon's knife to carve up and chop out whatever they think is ailing you, at great expense to you and great profit to them and the hospitals they work for. So I want you to go listen to a podcast we did quite a while ago, I think a year or so ago. It's called A Most Butcherous Story. It's podcast number 71. And I took care of this woman in our clinic. She started out 20 years ago with indigestion, heartburn, and gallbladder issues. And, of course, she started on the Prilosec and the antacids and went downhill, got her gallbladder removed, got on HRT, hormone replacement therapy. I saw her 20 years later, and she had been diagnosed with breast cancer. And it was just this downward spiral where just 20 years earlier, we could have cleared up her heartburn and her other issues so easily. And it just cascaded into this horrible butcherous story that I recount in podcast 71.
So,
what are the major symptoms leading to the medical decision to remove a uterus?
Yes.
Usually they're fibroids that cause excessive bleeding. Okay, lots and lots of bleeding. Endometriosis that causes excessive pain. And uterine prolapse, where the uterus actually protrudes out of the vagina.
Yeah, I have several patients, 2 that come to mind immediately because I'm seeing them right now who have uterine prolapse. And the spinal correction, if you understand the basic concept behind chiropractic, that it improves nerve function. Mm-hmm. We're not trying to take care of back pain and headaches and this kind of stuff. We're trying to improve nerve function by putting the spine back into its proper alignment that stops nerve interference.
Mm-hmm.
And so there are these two women I take care of now. I can see them clearly in my mind because I've seen them in the last 2 weeks. That when they have a good upper cervical correction and the spine is brought back into balance, it literally improves nerve flow to the ligaments that are supporting the uterus. They tighten up and it pulls back inside their body.
Wow.
And
that's powerful.
And one of them actually feels it while I'm working on her.
Wow, that's really powerful. Yeah. So we had, we talk about this excessive bleeding. We've had many women, and I'm thinking of one right now that, of course, she had excessive bleeding. And, of course, the doctor's only recommendation was hysterectomy. And I just happened to be talking to her one day, wasn't even in the clinic, and I was like, are you kidding me? You're just going to go take out your hysterectomy? Which you could,
uterus.
I mean, your uterus, you're going to go take out your uterus and possibly your ovaries, which are, so important. Why don't we try something else first? And so she came in and saw me. And to this day, she hasn't had her uterus taken out. So we just did some nutritional recommendations and protocols.
So what is leading to the fibroid growth, which is one of the major reasons for hysterectomy? And it's an increased, usually what's going on is an increased level of estrogen in the body. And the fibroidal, the tissue in the uterine muscle, the myometrium, the endometrium, these fibroid tumors will develop. And estrogen, of course, is what makes tumors grow. And so women should take measures to reduce their exposure to estrogen, obviously by consuming a diet that's low in the foods that promote estrogen, what are known as estrogenic foods. And also, we know that by avoiding the water from the BPA plastic bottles.
And don't microwave in plastic.
Yeah, this does. It releases the xenoestrogens
Try to stay
that are
away.
in plastics.
Yes. Stay away from plastics.
Well, to lower one's risk of fibroids, as I said, women should avoid the estrogenic foods and whenever possible, or consume them in very strict moderation, if at all, but you shouldn't. Yeah. And among the most popular estrogenic foods on the market today are soy products. Soybeans, tofu, soy milk, soy protein powder.
Yeah, and also the processed carbohydrates. And they have been heavily implicated in artificially raising estrogen levels in both men and women. I mean, both.
Right,
both,
exactly.
Yeah. So, and it's been suggested that this is one reason for such decreased levels of testosterone in men under 30.
Yes, because we know that women are the stronger sex. We also know that estrogen can push testosterone aside.
It displaces it kind of.
In a man as much as it does in a woman. Of course, a woman has much more estrogen.
Yeah.
Remember the podcast we did on chlorophyll where we talked about how close a chlorophyll molecule was to a
blood
hemoglobin molecule. Do you know how close the estrogen molecule is to a testosterone molecule?
No.
The testosterone, if I have this right, I might have it backwards. The two molecules are exactly the same, except for one tiny little attachment on the side of one of the molecules. But I can't remember if it's the estrogen or the testosterone.
Maybe it's a blonde curly hair.
Maybe it's the estrogen one. I was thinking with something sticking out, it might be the other way around.
That would be a man.
But one of them... they're both exactly the same, except for one small, little, tiny, itty-bitty difference. And of course, what a difference it makes inside our bodies.
Yeah, I mean, hormones are the most powerful thing in the world. One little hormone makes a boy and a girl a girl.
Yeah, at about around 8 weeks, between 5 and 7 and 8 weeks.
We should not be eating these, by the way.
Eating little boys?
Hormone.
Eating hormones.
Hormone replacement therapy.
Oh, okay.
We should not be eating hormones.
Yes.
We should be eating the foods that rebuild our own hormone glands in our body.
Well, several years ago, the National Institute of Health released a study that they performed on rats, and it showed a connection between vitamin D exposure and the shrinking of fibroid tumors in those rats. I was just holding my cat, and so I am Sorry, I'm responding to my cat. And so this finding suggested how important it is that women get enough vitamin D on a daily basis to mitigate the risk of acquiring fibroid tumors.
Yeah, we just did a podcast.
Yes.
It's called The Vitamin D Hysteria, and it was based on overdosing primarily on synthetic vitamin D and not lots of sunshine and cod liver oil. You can have all that you want until you get sunburned, of course, and get sick of the cod liver oil. But basically, that's the vitamin D you need to get in your life. So this so-called sunshine vitamin, it has innumerable roles in the body that are essential for maintaining proper health and, as the NIH study revealed, also plays an important role in fighting tumors.
Yes, it does.
So, other than consuming foods rich in vitamin D, meat, fish, dairy, and eggs, women, you guys, you should make it a point to get some sunshine every day to reduce your risk of fibroids. And that's just 20 minutes. A couple times a week, go outside, expose your arms, your
face
neck.
and neck.
Yeah. I don't know about the face so much, but try to get your neck and your arms. And if you've got shorts, your legs, try to get some exposure on your body so you can get the correct and the natural vitamin D, or take cod liver oil.
So that's fibroids. Let's talk about endometriosis.
Oh, endometriosis is such a painful condition. It affects women during mostly their reproductive years, and it's one of the most common reasons for infertility and, of course, chronic pelvic pain in women. So it's very painful.
During every monthly menstrual cycle, the tissue lining from the inside of the uterus, the endometrium, it builds up and builds up under the influence of hormones. And then finally, as that hormonal level shifts, it's shed off. And this tissue is what we call the endometrial tissue. And when endometriosis is present, this tissue grows and can shed outside of the uterus. And this causes lesions and constant inflammation that eventually can lead to scarring. And this comes from something that's called uterine regurgitation, which means as the uterus begins to slough off the endometrium as your period starts, due to contractions and other reasons, and it goes up into the fallopian tubes, out of the fallopian tubes, into the pelvic and up into the abdominal cavities.
Where it should not be.
Well, because the crazy thing about this is it doesn't make any difference where endometrial tissue is. When you go through your cycle, it's going to respond to the estrogen and progesterone, to the luteinizing hormone, and to the follicle-stimulating hormone. All of these kinds of hormones going through the body, wherever that endometrial tissue is. It's not like the hormones that control a woman's cycle are specifically delivered only to her reproductive organs. It's in the bloodstream. It's
flowing through the bloodstream,
It goes everywhere. So if you have endometrial tissue outside of the uterus, it will grow, and eventually it causes inflammation, because anytime blood comes in contact with collagen, you're going to have clotting, you're going to have other kinds of problems that take place.
And this makes me think of gotu kola, which is a wonderful herb from Standard Process. It heals internal scarring.
Yes.
And chlorophyll again, it just keeps coming up. Chlorophyll that is for systemic inflammation. Yeah. So it brings healing fats to inflammation or wound inside of your body. So those two would be really good. The nice herb and the healing, soothing properties of chlorophyll, chlorophyll.
The conventional treatments for endometriosis, of course, is surgery to remove the endometrial growth and or ovaries. In extreme cases, even a hysterectomy usually is advised.
Yes, but they don't address the foundational problem here.
No, they don't.
So they just cut.
Which we've already discussed.
Brutal.
But unfortunately, the research has shown that patients undergoing hysterectomies for endometriosis sometimes will still experience a regrowth of the lesions.
Yeah, because they don't fix the reason for it.
Well, it's outside of the body. The endometrial tissue is outside of the body. So even though they take away the uterus, there's still endometrial tissue outside of the uterus itself.
Not outside the body. You mean outside
the uterus.
You said the body. I was like,
outside
does it really grow on the outside?
Oh, there's some over there on the wall. No, it's outside the uterus. So we would say that without, as you were saying, without addressing the underlying cause, the reason for the endometriosis would just continue.
Now, listen, we don't want to throw guilt at women, but one of the reasons this has never changed foundationally in women is because they're told that it's not their fault and they were just the unlucky ones to get endometriosis. But it's totally not their fault. But I have to tell you, I have to be frank with you women out there, the forbidden information is that this can be changed and you women are indeed in control of this.
Good.
This can be fixed. This can be prevented from happening again. This can be helped. That's the forbidden information you're not given. You're just told, oh, it wasn't your fault, and here you need the surgery, and we don't know where it comes from, and we don't know.
And there's no long-term side effects, so don't worry about it.
Yeah, and then they don't tell you about the side effects of having a hysterectomy.
Yeah.
And all the other side effects, not the least of which is the massive antibiotics they give you during surgery. But that's,
Well, just as we gave you some natural ways to deal with uterine fibroids, there are natural ways to improve endometriosis symptoms nutritionally, especially things like nettle and saw palmetto.
Yeah.
That decrease the production of endometrial tissue. There's whole food vitamin C, and of course we recommend cataplex C, and bioflavonoids. They're important chemical compounds in several different kinds of plants and herbs that improve the immune system. A strong immune system will be able to destroy rogue endometrial tissue as it accumulates in the body.
Yeah, bioflavonoids, they help to relax muscles.
Bioflavonoids.
Bioflavonoids help to relax muscles and reduce inflammation and pain, and the best bioflavonoids are in chlorophyll. That's an oil-based chlorophyll that we talk so much about. And, of course, standard processes that we recommend. The only oil-based chlorophyll we found in the world is called chlorophyll complex pearls from Standard Process. We also recommend wild yam complex. So you need to take the wild yam prior to ovulation, and this can also help reduce endometrial symptoms. It also helps to balance menstrual bleeding. It provides, get this, guys, antispasmodic problems. It eases spasms of smooth muscle.
Which is where uterine cramping during your period usually comes from.
Yeah. And it also helps the intestinal tract cramping, if you have any of those, and the muscles associated with the menstrual cycle. It also helps with menopause and the joints. It's a wonderful wild yam complex. So for those menopausal women who are having chronic hot flashes, and I've seen them 20 years after menopause in women, and I'm talking years and years, this chronic hot flashes, we recommend you going on wild yam complex 25 days a month and then skip 5 because you still have a cycle even after menopause. You just don't know you have a cycle.
The estrogen doesn't get high enough. The levels of the FSH, the LH do not get high enough to cause ovulation.
The LH, yeah.
But short of that, sub-ovulation, it still goes on.
Yeah. Those without hot flashes really don't need wild yam, but those that are still having it after they menopause. And then
there's also flaxseed oil, as we see in linum B6 and in evening primrose oil, which are good sources of essential fatty acids that regulate the production of prostaglandins. And there are prostaglandins that decrease inflammation and pain. There are prostaglandins that increase inflammation and pain, often associated with the menstrual cycle. So flaxseed oil is a good way to regulate the production of that. And then there's also inositol, there's choline,
Ooh, great
both
ones.
of which help the liver to process estrogen, because too much estrogen, as we've described here several times, can lead to endometriotic symptoms.
Yeah. Some herbs that we recommend are chaste tree. I love chaste tree. I still take chaste tree, and I'm through menopause. And Don Quai. These are hormone balancers, and they can help reduce the buildup of endometrial tissue and the associated pain, of course, with that. And these help women with perimenopausal heavy bleeding and postmenopausal irregular bleeding, those that continue to bleed here and there after. And it also addresses non-cystic acne. Chaste Tree, I've noticed, has helped that even with me.
Yeah.
But I just want you to know our Ageless Thyroid addresses cystic acne.
Yes.
We've had many testimonials with women that have cystic acne, and it's helped them. So to take Chaste Tree, if you're having regular periods, this is important to listen to this for your cycles. If you're having regular periods, then take 5 days off from the first day of your period, and then take Chaste Tree daily until your next period starts. Okay? And you can get this in a liquid or a pill. I recommend the liquid. I know it doesn't taste super good, but I actually kind of crave it. I really like Chaste Tree. And
you still take it?
I still do, because it really helps sleep, and it helps acne, and it seems to just kind of, for the reason I take it is because it helps build progesterone in your body naturally. And of course, estrogen-based breast cancers are way too prevalent. So I just help keep that little estrogen in check in case my liver's not taking care of it.
Yeah.
So I love Chaste Tree. So those women that are perimenopausal, have heavy bleeding, and postmenopausal, that have irregular bleeding, are helped with this. So if you don't have regular periods, then take it for 25 days on and 5 days off. And if you have a period show up unexpectedly, then take another 5 days off from the beginning of that period. So in other words, if you're a young woman that has sporadic periods, take the Chaste Tree. But if you just suddenly start your period, then stop it for 5 days. And then go back.
Stop the Chaste Tree for 5 days.
Stop the Chaste Tree for 5 days, and then go back on it. And then it also helps with hot flashes. And then Dong Quai.
Yeah, Dong Quai helps menstrual cramps. It helps to reduce fibroids. It helps to reduce hot flashes, especially in postmenopausal women. It helps sleep disturbances. It helps fatigue. And the SP version promotes healthy, I'm reading here from our notes, promotes healthy reproductive system function, eases menopause and menstruation, mild constipation, support and maintains normal fluid levels around the joints, helps with emotional environmental stressors, and it promotes a healthy circulation. All in just the Dong Quai, which was well known in Japan, China, and Korea. Now, of course, it's spread to America because of its effectiveness in the female cycle.
Now, we only have Dong Quai with MediHerb as a liquid.
Yeah.
Unfortunately. I've never tried it, but
I haven't either.
But if you have menstrual cramps and fibroids, it's highly recommended. A Dr. Kathy Wong from verywellhealth.com really recommends Dong Quai.
Okay, before we go on and talk more about the last cause of hysterectomies, uterine prolapse, I want to bring up the free symptom survey that we offer at forbiddendoctor.com. The survey has many questions. It's the most comprehensive survey you probably would ever take. And after you're done, you have the opportunity to have a free 30-minute phone consult. And as a result, you'll be given a personalized protocol. Up to this point, it's still free, which saves you money in the long run because you won't be taking supplements you don't need, and all of this at no charge to you.
Yeah, and if you decide to purchase the recommended supplements, you can get them at a 10% discount if you sign up for our text blasts. And these blasts, they come out about once a week, give you fantastic coupons, and all you need to do is text the word healthy to 41411, and we'll text you back a coupon code, which you can use on our website, forbiddendoctor.com, when you check out. Or, to make it easier, you can call our office, 801-523-1890, and they can help you sign up for the text blast if you don't know how. And remember, your patronage of our offers keeps this podcast on the air.
Yes.
Yeah.
So the medical definition, thanks, Mary. Mm-hmm. The medical definition of uterine prolapse is this, and I'm quoting from the medical dictionary. Uterine prolapse occurs when pelvic floor muscles and ligaments stretch and weaken and no longer provide enough support for the uterus. As a result, the uterus slips down into or protrudes out of the vagina. Uterine prolapse can occur in women of any age.
Yeah, this is a real malnutritive. How do you say that? Malnutritive problem, where you're not getting enough protein and fat to rebuild and strengthen these ligaments inside of you. And it also causes aging and wrinkles and everything else. So on the outside, So this is really important. Many gynecologists feel that the only way to treat a failing or falling uterus is to remove it.
Yep.
Okay, that's the hysterectomy surgery we're talking about. And then what they do is they attach the apex or the top of the vagina to healthy portions of the ligaments up inside the body. Never addressing the underlying cause, of course.
No, because there's no long-term effects from their perspective. Of course there are. And there's minimal risk with the kind of surgery that's involved, and unless those minimal risks hit you.
But you just need to know, this is not their fault. You just need to know this is the way they look at your body. Is
a time bomb went off.
Yeah, or it's something to fix. In other words, not to support and revive and renew.
Yeah.
It's to fix something. So it's not them we're harping on. We just want you to understand that what they do is they go in and repair the ligaments, and they think that's all that's needed to correct the uterine prolapse. And this surgery is nicer and better than a complete and less risky than a whole hysterectomy. And so now they're saying, maybe the whole hysterectomy is not medically necessary. So they've developed this operation recently, actually, that uses a laparoscope. Laparoscope? Yeah.
Yes, laparoscope.
They uses not laparoscopy that they use for gallbladders and stuff like that. This is a laparoscope to repair those supporting ligaments and preserve the uterus. Yay!
Yeah, the laparoscope is the way they look inside. It goes inside, they look around, and it has little tools, and they can do their stuff rather than taking the whole uterus out.
Yeah, and I think this is better. I mean, in combination of a good nutritional, supportive diet that we'll talk about in a few minutes, maybe do this. Maybe this would help you. But we're just letting you know what the medical people.
Yeah, well, these ligaments that we're talking about here, if they took the uterus out, then they would attach these ligaments to the apex of the vagina to support the vagina. But this surgery is saying, no, all we need to do is work on those ligaments. They're the uterosacral ligaments. And they come off of the sacrum, they attach to the top of the uterus, and they hold it up like strings on a marionette. And if you could imagine the strings on a marionette getting weak and lax and saggy, it's so that one side of the marionette or both sides start to fall down when you're trying to operate it, you get an idea what's going on inside the uterus. And so these ligaments are most often damaged in the middle of the ligament, while the lower and the upper portion are still usually pretty strong. And so with this laparoscopic procedure, the surgeon will cut out the weak small part, bring the stronger upper and lower parts together, put in permanent sutures, which accomplishes the repair without having to remove the uterus. And so this procedure requires a shorter stay in the hospital and a quicker recovery. And realize this, that the surgeon just looks at what you have rather than improving what you have. Again, they're crisis care doctors. It's not healing something. They're just taking care of a crisis care. And so the forbidden information is that ligament tightening can be accomplished through better nutrition. It takes longer, obviously, but there's no serious side effects that surgery can cause that we've already been talking about.
So let's talk about nutrition and how it plays a role in tightening and strengthening the uterosacral ligaments.
Yes, of course.
Yeah. So what causes the slackness of the ligaments to begin with?
That's the why part we do that the medical doesn't do. Medical just does the what. Slack ligaments, cut them out. We say, well, why are they slack?
Poor diet.
Yeah.
And inactivity and sitting for hours and hours at a time. So those of you with a desk job, I know women are usually running around, but, for those...
Some women, I take care of a lot of women who've got a 9-to-5 job.
Yeah, they sit in
a chair.
8-9 hours a day, and that can lead to slackness of your ligaments. And multiple pregnancies is also one of the causes, and it can cause poor muscle tone and just general poor muscle tone because you eat way too many salads and I have to throw it in, Jack, I'm sorry.
I know.
And not enough fat and protein because you think it'll make you fat. So, but this also does happen to women who've never been pregnant and never had anything stretched out.
Yeah, and so the diet that you keep mentioning here, the standard American diet.
The sad diet.
Yes, which is loaded with processed foods. Not enough raw foods doesn't offer the nutritional approach we're talking about. In fact, it works against the body's attempts to rebuild and heal itself. So the nutritional recommendations to strengthen ligaments. And I don't care if I'm talking about uterine prolapse or I'm talking about a teenage boy or girl involved in high school sports, or somebody who's had a sedentary life and they want to move back into more exercise. You need a diet rich in meat, fish, dairy, and eggs.
Yeah.
Because this supports the right proportions of protein and fat that's in the ligament. Broccoli doesn't do that.
No.
Spinach doesn't do that.
Don't rebuild those ligaments with that.
Peaches and cherries and oranges and apples don't do that. As nutritious as those foods are, they do not build the ligaments. Ligaments are dense fibers of collagen. And collagen is made from certain amino acids in the presence of whole food vitamin C, not ascorbic acid.
Because
whole
remember,
food vitamin C.
Vitamin C is the loom that protein winds itself around to make good, strong collagenous fibers and ligaments. And ladies, this will also help lift up your face and help reduce wrinkles and everything else to go on the vein end of it. But that is what is so important to eat.
So we recommend protofood for the amino acids, Ligaplex 2, which is a powerful ligament rebuilding food.
It's probably one of the most dense supplements Standard Process makes, is Ligaplex 2. If you look in the ingredients on that, phew. Okay, sorry.
That's right. Cataplex C,
the whole food vitamin C.
Utrophin PMG, which is the protomorphogen for the uterus, Utrophin PMG, and tuna omega-3. So that takes care of the three major reasons. There's others, but the three major reasons for hysterectomy. So let's recap.
Okay. One of the first things we would recommend to help this very painful condition, the endometriosis, is what?
What you're about to say. I love it.
Oh, you're scared about this, aren't you?
No, it's so revolutionary.
It's forbidden.
It's heretical.
It is. But I'm going to say it anyway because I always say this, and I love it. I love being this forbidden because we women out there, we got to band together and we got to fix this thing. So one of the things we recommend is for you women to stop your habit of having a green drink every day. Just throw it away.
Yes, I know this is heresy.
Yeah, this is heresy. This condition, or the conditions, all those three conditions that lead up to you needing or being recommended a hysterectomy by your doctor are not because you are toxic and need to cleanse. And remember, juicing and vegetables only cleanse you. They do not rebuild you. You need to desperately rebuild your ligaments, your hormone glands, and smooth muscle.
Yes, absolutely. So instead of that green drink, do Mary's milkshake.
Yay!
Her raw egg shake. You don't need it every day. Twice a week's probably plenty.
Yes.
But the forbidden information is that raw egg, along with all those other powdered nutrients in that shake, will start you on a road to recovery and rebuilding that no green drink could ever do.
Yeah, we'll have this recipe at the end of the podcast. And I have to say, we know this is diametrically opposed to everything you have ever thought or been told about being healthy. I mean, women are going to go out there and start drinking these green drinks. I mean, that's what they do when they think, I'm unhealthy.
There's a problem. They immediately turn to a green drink, which is usually way too much sugar.
Way too much sugar. And it doesn't have the protein and the fat that you need so desperately to rebuild your ligaments and clean up everything inside of your body in the sense of getting rid of the fibroids and the prolapse. It will pull, the pulling up of that and the bladder and everything else. This is forbidden information, and we're just compelled to give it to you.
So Mary's Milkshake, and we have a link for that at the bottom of the podcast, has calcifood powder, cyrofood powder, SP Complete, which is a meal replacement all in itself. And it comes in vanilla or chocolate and whey protein complete. And I'd recommend also adding inositol powder.
Yeah.
Because that's what I put in my shake.
Yeah, and I have that in our shake too. When we make it for us, I always add inositol powder. I also add prebiotic inulin in it too for my gut. But just follow the milkshake. The only thing that's not on there is the inositol powder, which I think you women need that are in.
It's one of the B vitamins, inositol.
Yeah, it's sweet, and it sweetens your drink too. You can throw in some strawberries or blueberries if you want, but know that is not the powerful thing inside of the Mary's Milkshake. It is the raw egg. So don't forget to take choline. We recommend 3 a day. Protofood, which is the broken down protein into amino acids. It's essential.
The essential, right.
You have to get them from your diet. It's essential to get them from your diet. Your body doesn't make them. So 3 Protofood a day, 6 to 9 Ligoplex 2 a day, 12 Cataplex C, and that's a day, so you can split that up 6 and 6. 3 Eutrophin PMGs first thing in the morning on an empty stomach. 6 tuna omega-3s throughout the day, as they're really good omega-3, and they have the EPA and the DHA that you don't usually get in your diet and you need desperately for your endocrine health. And add in a good flaxseed oil like Linen B6 it's been hermetically sealed to where it never hits oxygen. And this is very important. If you go buy the flax oil in a bottle, as soon as you open that cap, it starts to degrade. And every time you open that cap and pour it into your shake or whatever, it's hitting oxygen and it's degrading. So we recommend the Linen B6. It's very inexpensive. Flaxseed oil. This is the way Dr. Royal Lee made it many, many decades ago. And then the herbs we recommend are chaste tree. 1 teaspoon of chaste tree at night. I recommend the liquid, but you can take the pills. It helps you sleep and it clears acne. Wild yam tablets, 3 to 4 times a day prior to ovulation. Remember, you stop when you start your period. Oh, that's wrong then.
No, no, it's just, excuse me, just prior to ovulation. A lot of women know when they ovulate. And if they're regular, they know around the 14th day of their ovulation. That's when you stop.
Oh, that's for yam. I'm mixing up the chaste tree and the wild yam. Okay. So 3 to 4 times daily prior to ovulation. Nettle root and saw palmetto, which are in a product from Standard Process called Prostaco.
Yeah, and the Prostaco has Crotava stem bark, which helps to reduce prostate swelling. So, honey, if your prostate is swelling. But it also shrinks uterine lesions.
Oh, that's so important.
Because both the uterus in a woman and the prostate in a man both arise from the same fetal tissue, a form of something called mesenchyme. And along about the 9th or 10th week, there is a chemical change so that the female that's developing it becomes a uterus, and the male that's developing it becomes a prostate.
Oh, so that will help shrink that.
And it also has pumpkin seed oil, which helps support the overactive bladder and kidneys and inflammation.
Wow.
Now, this may seem like a lot of supplementation, but I guarantee you there's a lot easier, to take than heart disease, breast cancer, surgery, and drugs for the rest of your life with all their side effects.
Yeah, and the cost of that. People don't realize the cost of that. And you have to eat anyway, so eat these foods to support this.
Yeah, and unlike the violent side effects of surgery and drugs, and listen, we know that there's a crisis situation that can arise. We know that there are emergency.
Sure.
I mean, if you have a fibroid tumor that hemorrhages.
Oh, yeah, you can die.
Yeah, you can die in a very short period of time. You get to the emergency room, you get into surgery, and may or may not have to have a hysterectomy, but they probably will because it will save your life.
Yes.
What we're talking about is the needless surgeries.
Yes, and also after you have this life-saving surgery, how to fix the reason for it happening in the first place so it doesn't happen again.
Yes, so what we're talking about is rebuilding every collagenous fiber inside the body. And yes, ladies, even your wrinkles.
Yes.
You have to eat. You got to spend money on food. These supplements are just food. They're not synthetics. They're food and medicinal herbs. I'd also add in ageless thyroid, of course, which loops the endocrine system back together and has the essential nutrient in it that almost all these functions require, iodine.
Iodine, yeah. So to recap how to address this nutritionally, and I'll make a protocol on our website called Hysterectomy Avoidance, How to Support a Healthy Uterus. The first thing, and I'm just going to list these down. You don't have to write them because you can go to our website, forbiddendoctor.com, and search hysterectomy. And this protocol will come up. First and most important thing is Mary's milkshake. Throw out the green drink and drink my milkshake, the raw egg shake, at least twice a week. And make sure to get the accompanying powders, including inositol powder that is not on the recipe. But I'll put it in this protocol. And then the supplements we recommend are Protofood, the amino acids, Ligoplex 2 to help support those ligaments, Cataplex C to help rebuild with the protein, your ligaments, choline, that wonderful B vitamin, eutrophin PMG, which helps any autoimmune attack that might be happening on your uterus, tuna omega-3, ageless thyroid, of course, to loop back the whole endocrine system back together, and lignum B6. And then
there's herbs, chase tree, wild yam, prostico, which is nettle root, salt palmetto, crotava stem bark, and pumpkin seed oil, all in the prostico product. And then Dong Quai liquid, if needed for postmenopausal abnormal bleeding or hot flashes. And then eat a rich diet, eat a diet rich, I should say, in and as raw and clean as you can get: meat, fish, dairy, eggs, and spices.
Yeah, and if you've already had a hysterectomy, we'd recommend following the supplement protocol on our website for hysterectomy post, as it's called on our website, hysterectomy post, to support and fix the reason for needing a hysterectomy. And understand this forbidden information. The surgery, the hysterectomy, did not fix the reason you needed a hysterectomy. It only removed the symptom.
That's very, very good, Mary.
That's what I want to end on.
That's right.
You need to feed your body.
It didn't fix the problem. It fixed the immediate pressing symptom.
Yeah.
It didn't fix the underlying cause that led up to that.
And you are in control of this. This is not just a gene that turned on with you. This is not just something that just you were unlucky you. You can control this. You need to get the processed foods out of your diet, the alcohol, the overuse of caffeine and, Diet Cokes and coffees and everything else that, we way overdo. The high fructose corn syrup, the breads, the way overuse of breads in our diet that fill us up, that do not nutritionally feed us. And if you don't get that out, then supplement. But otherwise, if you can avoid a lot of this by just eating good, clean, as raw as you can take meat, eggs, fish, and dairy, and spices in your diet.
And even if you've done it before, don't forget to do our free symptom survey. We offer it at forbiddendoctor.com if you're facing this most brutal of surgeries, hysterectomy. And so at the bottom of the survey, you would write in hysterectomy, considering getting a hysterectomy, have had a hysterectomy, whatever. And we will give you the protocol that we've listed above, personalizing it just for you. And what you've explained in the surgery about your symptoms, we will address that as well.
Yeah, and you'll get the opportunity to have a free 30-minute phone consult with one of our nutritionists, which can be very helpful in customizing this further for you.
Yeah, and understand the survey saves you money in the long run because you're not taking supplements you don't need. All of this at no charge to you.
And if you do decide to purchase the recommended supplements, you can get them at a 10% discount if you sign up for our text blasts. So they give you fantastic coupons every week, and just text the word healthy to 41411. We'll text you back a coupon, which you can use on our website, forbiddendoctor.com, when you check out.
And if you'd like 20% off all the time, then join our VIP membership. Just go to forbiddendoctor.com/VIP, listen to a short video on the benefits, and start your healing process.
And the lady that recommended we do a hysterectomy podcast today said she doesn't know how she could have healed. She had a really bad accident happen, and she doesn't know how she could have healed without that VIP membership.
Good.
Because she's been able to talk to us once a month and, of course, be able to afford the supplements better because of the 20% off.
But she's back up on her feet and running around now.
She's doing great now. Yeah. And she attributes it to us giving her very detailed recommendations and protocols and not spending money on things she doesn't need.
Or you can always call the office, 801-523-1890. They can help you sign up for the text blast, sign up for the VIP, or just answer any questions about the supplementation and the Forbidden Doctor's mission.
Yeah, because we're revealing health secrets they don't want you to know. And remember, your patronage of our offers keeps this podcast on the air.
So don't forget to tell your family and friends to take our free symptom survey. It's for everybody.
Yeah.
At forbiddendoctor.com to find out where they are. It's free.
Yeah, and they'll also get a free 30-minute consultation with no obligation to them. And I have to read this. The statements made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product label or packaging or this podcast is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professionals.
So thanks to all of you for listening to this forbidden information in our Forbidden podcast. Join us next time for another in-depth discussion of forbidden knowledge.
And we will see you then.
See you then.
Thank you for listening to the Forbidden Doctor podcast. If you are curious about long-life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from Amazon.com by searching the full term, Long-Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.